Man's best friend just got a promotion. While they come in all shapes, sizes, and demeanors, all dogs provide a significant purpose in our lives. Some dogs love to play, jump, or run around with their family, while others would prefer to just hang out. Some dogs may even love just looking at themselves in the mirror, but maybe the coolest dogs of all are the ones that have a really important job, providing assistance for their owners.
There are 3 types of assistance animals highlighted by the Americans with Disabilities Act. Therapy animals are socialized and trained to provide comfort and affection to people in various stressful environments. Therapy animals are most commonly seen in hospitals, nursing homes, schools, and disaster areas. While dogs are the most common, therapy animals can also be cats, horses, and rabbits, as well as other animals.
Service animals, as defined by the ADA, are any animal individually trained to do work or perform tasks for the benefit of an individual with a disability, including physical, sensory, psychiatric, intellectual, or other mental disabilities. We usually see dogs in this role, but sometimes miniature horses like Lil Sebastian can also be used as service animals.
Emotional support animals are another type of assistive animal. These being most commonly dogs, are relationships that are prescribed by a doctor or licensed therapist to provide therapeutic benefit through dedicated companionship for a person who suffers from an emotional or mental disability.
Since assistance animals have been so useful to so many, especially in nursing homes, it is worthwhile to consider how we can bring occupational therapy and assistive animals together in order to improve the care we provide to the elderly population. Besides, the research says it all. A study that analyzed the efficacy of pet-facilitated therapy in long-term care facilities found significant positive changes in mood for patients who had recurring visits with a therapy dog. Other studies also demonstrated that dog companionship for the elderly population reduced their perception of loneliness and had positive effects on quality of life. Here's what Anne, an individual with significant experience training therapy dogs, had to say on the matter.
Therapy dogs can be used just for visitation, where the client can pet, cuddle, or just spend time with the dog. This is considered to fall into the category of animal-assisted activities, or AAA, and is the most common application for therapy dogs within places like nursing homes, hospitals, and schools. It can be helpful to lift anyone's spirits, give them something else to focus on, and receive unconditional love with the comfort of touch that many people seek.
With service dogs, the story is the same. Quality of life, participation, and independence were all positively correlated with the involvement of a service dog in the resident's life. Megan Sebahar, who has experienced training service dogs, had some more light to shed on this.
Can be really beneficial for older adults. So things like mobility and safety tasks, they can retrieve medicine, they can open and close doors, retrieving other objects like your socks or your shoes, all of that I think would be particularly beneficial to people who might be in a nursing home, because that can be contributing to safety precautions, engagement in occupations and stuff. I think also something that all service dogs are really good at is companionship. It's usually not something that they're trained to do, but it's just something that comes naturally with having a dog, is that you develop a bond, and having that companionship and emotional support is really, really beneficial for people.
So how does occupational therapy fit into all of this? Well, as reported by rehabilitation specialists, the research suggests that motivation, physical participations, and alertness were all observably increased in clients that were also interacting with therapy dogs during their session. Occupational therapists specifically have also highlighted that a therapy dog can be used as a modality for intervention. The role here for the occupational therapist is to effectively use the animal to improve the outcome of the therapeutic session, and provided some examples of how this would look in practice.
Where I see the application to OT with therapy dogs is in animal-assisted therapy, or AAT. In a nursing home, this could be incorporated into nearly any intervention. If you're looking to increase walking endurance, but the client is unmotivated, you might have them walk alongside the dog or even hold the leash and perform the activity themselves. You could practice sequencing by preparing the dog to go for a walk, or train cognitive skills by teaching them how to train the dog a new trick such as a loose leash walking or rollover. Therapy dogs can also be useful as a complementary intervention if you are working on things like mindfulness techniques for anxiety or depression reduction. For those who love dogs, being in their presence and petting them can be a very uplifting and soothing experience, assisting them to remain in a good state of mind for the session.
As highlighted by the AOTA, service dogs work great as an adaptive strategy for intervention. They help with ADLs, home management, functional mobility, socialization, emergency alerting, and environmental controls. Because occupational therapists currently are one of the primary healthcare providers responsible for assessing elderly patients' assistive technology needs and recommending appropriate adaptations, they are in an ideal position to expand this role to recommend a service dog as an adaptive strategy.
Commands that I was training the dog to do for someone are all really related to occupations now that I think about it. So things like the dog can assist with like dressing and undressing. So like retrieving your shoes and socks, taking off like zippers or sleeves, so helping you with those types of tasks. They're trained to assist with tasks that can be specific to like going to work or getting an education and being in school. Also things like medication management, like I said, being able to retrieve like pill bottles and stuff. The person who got the dog that I worked with, he received OT services, and something that his OT did was actually started incorporating the dog once he got it into the therapy sessions. So like she started giving him weighted like therapy balls and was like, how about you take these home and you play fetch with your dog? So that way, instead of doing like simple like, interventions to support occupations, like just doing some strength training, he was able to do it in an occupation that was like meaningful. So he was able to play with his dog. And then another example I have is from someone else who got one of our dogs. He actually reported, I guess this is more like health kind of related, health management. He noted that when he got his dog and he would go to his doctor, he was like reporting lower heart rate and lower blood pressure. Like overall his like the stress impacts that he was always noting at his doctor were a lot lower because he had the dog with him.
A final thought we wanted our experts to talk about, discuss the possibility of assistive animals playing a role in assisting clients to re-engage in modified care of their own pets after an injury. Here's what they had to say about how it could relate to occupational therapy.
That is absolutely a wonderful application of a therapy dog. A client might need to practice tons of things, particularly if they had to modify the way they did things, and chances are a therapy dog will be much more willing to go through that process. While we all love our animals, they have their quirks, and it may be difficult for the client to begin the process with their own dog. Even if they need to use the therapy dog for practice simply because their dog can't come into the setting, I still think it would be an applicable precursor to carry out the modified task with their own animals. Another way this can help is as a motivator to get the client to the level of functioning they need to return home and take care of their own pet. Seeing that they can accomplish these tasks can certainly increase the self-efficacy for re-engagement in this occupation.
See a service dog as being kind of this like safe space for practice. So like an example I thought of is like if you are relearning how to take care of your dog and that like involves feeding your dog, like so you need to plan out, how am I going to pick up the bowl off the ground, get the food in there and put it back on the ground that's safe for me. You can't practice that at home because like what if you put the bowl down and it spills or something happens and then your dog rushes the food and then you might feel unsafe and so it could be a mess. But like if you practice that with a service dog, it would be a really realistic setting of like, okay, the dog's right there and they're waiting for their food. But like if I spill the food or if I take too long, like the dog's just going to sit there and wait because they're well trained enough to know like, I can't come here until you give me the command to come to my food.